While I will vote for this budget despite having major reservations, I'd like to say a few words about how labor, health, and human services and education programs are handled here, keeping in mind that of the 12 subcommittees of appropriation, the Labor HHS subcommittee never even had a subcommittee markup of the bill. After defense, the Labor HHS subcommittee has the largest portfolio of programs that deal with people's everyday lives, the lives of ordinary Americans. The allocation for Labor HHS was only $217 million above the 2013 pre-sequester levels. Only 12% of the non-defense funding increase, even though Labor HHS makes up 32% of the non-defense budget. And this also despite the fact that we had over $1.4 billion in funding holes that had to be filled. The holes existed primarily because a few critical programs were living off of money appropriated a number of years ago, and that money is now all gone. And unlike all of the other appropriations bills, we were prevented from using all of the options at our disposal to ensure reasonable funding levels for our important priorities. As a result, many critical programs here are still seeing deep sequester cuts. National Institutes of Health, the key driver of biomedical research in America, spurring innovation, economic growth, good health for millions of Americans. Yet only 58% of the sequester cuts are restored in this budget. It is $700 million short. Job training services, part of the core essential role of government, help responsible people succeed because of their hard work. Business secure the employees they need to grow. Job training programs were only restored by 81%, short $45 million. Title I, which aids at-risk children. IDEA for children with disabilities. Two fundamental building blocks of our K-12 education system, only restored by 85%. This bill does include some welcome and some much-needed funding for other priorities, and for that I am grateful to Ranking Member Lowy and to the unbelievably devoted staff, David Reich and Lisa Molyneux. Those priorities include mental health, Head Start, child care. We need to do more to support these programs, given the decade-long trend downward for labor age funding. Level funding is not enough. We endanger our families and our future by shortchanging these programs. And while I will support this budget, as we move forward, we can and we must do better by America's families. And
The gentlelady from New York reserves, and the gentleman from Kentucky is recognized.